Assalamu alaikum wa rahmatullah. Welcome everyone. معكم رنيم Ansari. I will be presenting the nutritional aspect for women health promotion. So in regard to nutrition care for women, we need to assess the different lifestyles that most women have, including a busy lifestyle, having long working hours. In addition to this is usually accompanied by unhealthy eating habits, as well as lack of activity and lifestyle-related disorders, including, for example, obesity or diabetes and these related conditions. So how can we manage having a healthy lifestyle? There are general tips, including eating breakfast that is very healthy, as it gives a much needed raise in the sluggish of the basal metabolic rate. Also avoiding one bite meal as a mid-time snacks, as these will usually bring in empty calories, meaning it wouldn't have any nutritional value. It will just increase our energy intake. Also, these including negative caloric food. As I mentioned, these are the foods that will increase our energy intake, but will not add any nutritional value. But some of the tips are to include food that are rich in antioxidants, phytochemicals, as well as energy boosting food such as flaxseed, bronze, walnuts, almonds, and these types of snacks that will add a nutritional value to our diet. Also including sources of high biological value protein such as soybean, meat, chicken, as well as egg as a high source of protein that is readily available and can enhance our nutritional value. And most importantly, regarding women health, we need to improve calcium and iron intake. This can be done by adding sesame seed, some type of flours, as well as skim milk powder or soy flour to increase the iron content of these foods. In addition to adding oat bran, wheat bran, and even these to boost our fiber intake, as this will help in adding more satiety as well as having a better glycemic control. In addition, we should include wheat germs to boost vitamin E intake as an important source of vitamin that we should include. Another important consideration is having olive oil or olive and rice bran or peanut oil as rich sources for omega-3 intakes and monounsaturated fatty acid intake as well. In addition, we should choose fresh fruit or over fruit juices, as this will add more fiber and vitamin intake to our diet, rather than just drinking a juice, which will add more sugar to our diet and wouldn't have the same energy content. Also, using fats and oil on limited quantities as to not over increase our fat intake, and avoiding sugar drink as well as soft drinks in general. Also, some of the things that we should avoid include processed packaged food, as these will usually have very high content of salt. In addition to avoiding excessive intake of bakeries, which are carbohydrates, such as biscuit, toast, or bread in general, as well as avoiding excessive use of sugar or sweets and dessert, as well as ketchup that will have additives and energy drinks. Another important aspect is that we should avoid overcooking of the food, including over browning of the food that will lead to many things, including the development of carcinogenic substance, as well as losing the nutritional value of most food when it is cooked for a long period. Also, avoiding stress while eating is another important factor, as it may cause heartburn or colitis, and eating slowly by chewing probably and using fork and spoon to decrease the portion size can be a helpful technique to control our energy intake. Another important consideration is taking or drinking enough water, as thirst can signal some signs that can be mistakenly taken as a cue for hunger, but in fact, the body is just dehydrated and not hungry. So, eating small, frequent meals, not using food as a reward, and making heart healthy substitute by reducing salt intake and increasing calcium intake. Also, eating junk food in moderation can be recommended in these cases. So, how can we make healthy lifestyle choices? This includes learning how to read the food labels, also de-stressing when we are eating, as this will be helpful in avoiding overeating or stress eating. Also, sleeping well for at least 8 hours and going for a regular health checkup can all be helpful tips for including a nutritious, healthy lifestyle. So, for working women, most of them will wake up late, grab some cereal or easy to prepare food to work, and by 11 or 12 o'clock, they will realize that they are starving and therefore will try to access the most readily available food, even if this wasn't nutritious food, and mostly it is just empty calories or high in fat content. So we shouldn't let time be our enemy in terms of affecting our health on a negative impact. So if we don't think that there is time in the morning, then the routine can make it in the night before. So preparing the breakfast at night or planning what to prepare in the morning can all be helpful tips in ensuring that we eat a healthy meal at breakfast. So when time isn't a concern, we will find that it can be enjoyable to plan lots of healthy treats to enjoy on the following day. So planning the snacks, as they are perfect way to control our blood sugar levels and therefore our hunger. So planning a few healthy snacks for the time when we know we will get hungry, including low-fat yogurt, for example, carrot with cottage cheese, or slice of wholemeal bread with honey, or even reduced sugar jam, are all better alternatives than just consuming uh, junk food at work that is readily available. Also, if you are not used to eating fruit, we shouldn't punish ourselves by checking in the dietary apple unless we are apple lovers, for example. So try to make it fun by slicing the fruits up, adding some lemon juice, including toasting red grapes. So we will have some delicious snacks that are also very healthy as they are fruits. In addition to preparing sandwiches that are interesting, like the ones we would tend to see on supermarkets, for example, or wraps. So we should add a protein source with a vegetable sauce, such as tomato, lettuce, and other high fiber content that are also nutritious. So, for example, if we want to prepare any sandwich wrap, we can prepare the stuffing at night and then stuff it in the morning for a delicious lunch. Also, having ready-made solution when we are shopping, we should go for shredded cabbage, for example, sliced vegetables, all of which can help us to make better choices when we prepare our work snacks. So baking also called pasta salad can be very helpful choices that we can include for lunch at work and as a great option to be included. So for protein, we can add some chicken or turkey or even eggs as a high source of protein. in addition to adding vegetables, as we mentioned, for example, lettuce, cabbage, or tomato. And for snacks, we can add fruit, as we have mentioned earlier, with some additions of sauces. So while we are eating out, it is important to also have tips on what to include and what not to choose. These can include choosing smaller sized portions. For example, if we are eating pizza, we should choose the one with a thin crust and go easy on the cheese and extra meat topping, but rather choosing sauces that are rich in fruit and vegetables as an alternative good source. So these are some examples of alternative food that we can use. An important aspect that we need to discuss is nutrition for pregnant and lactating women. So pregnancy is a normal physiological phase where rapid growth of the fetus takes place in the mother's uterus along with changes in her body. So the physiological and hormonal changes can help in better accommodating for the fetus, and the low blood or the blood sugar levels and breathing with the cardiac output are also increased in these cases. In addition, levels of progesterone and estrogen in specific will rise consistently, and therefore this can alter the hormonal balance as well as the nutrition factors. So the physiological changes included changing the energy metabolism, as the basal metabolism will increase due to development of the fetus and some other physiological changes. So the increase in the basal metabolic rate relatively to pregnancy values are about 5 to up to 25% during the first, the second, and the third trimester. So growth of the maternal tissue is also increasing, with the maternal tissue including the breast, the uterus, and the adipose tissue that increase in size. And these hormones all promote growth and changes in the breast tissue, and therefore should be accounted for when we are planning a nutritional intake or nutritional recommendation. Some of the elementary function include reduced gastric tone and motility with secretion, as well as nausea and constipation, which are very common, in addition to efficiency of absorption of the calcium, iron, vitamin B12, and other nutrient increases. In addition to the renal function that will be affected, including the glomerular filtration rate that increases to clear the substance such as creatinine, urea, uric acid, and these substances by the kidneys. So the rate of excretion of water is higher in mid-pregnancy and is very low in advanced stages, in addition to having mild glycosuria that is common and increased loss of free amino acid and iodine in urine. Also, this is accompanied by decreased excretion of calcium and B vitamins as well. And for blood composition, it also changes as the plasma volume increases about 50% and the RBCs increase by 20%. So increase in the total hemoglobin but decrease in its concentration is also common, and fall in the total serum protein is happening with decrease in concentration of vitamin A, vitamin C, and increase in concentration of carotene, tocopherols, cholesterol, and N-methylnicotinamide. In addition, water balance and weight gain will happen, as the average weight gain is about 12 kg, but it may range from 6 to 18 kg. Also, total body water increases by an average of 7 kg. So kidney may have some difficulty in disposing these waters as well. Therefore, these should be accounted for when we are planning their dietary factors. And for the complications such as nausea and vomiting, these are due to nervous disturbance, a placental protein intoxication, or derangement of the carbohydrate metabolism. So feeling of nausea may be higher if the food is eaten at too much hunger, and frequent and small meals should be provided as a better solution. Including fat-rich, fried, spicy food should be restricted as it can have an impact of empty calories, therefore should be avoided. Another complication is leg cramps that is due to sudden contraction of the muscles related with decline in the serum calcium level, as well as fatigue complications that are caused by progesterone distribution and therefore should be accounted for in the developmental stages. Also, heartburn is a very common complication, including that is due to increased progesterone level, which decreases the smooth muscle mobility of the stomach and pressure by drawing the uterus on stomach. So it can be relieved by providing more frequent meals and drinking fluid between meals as a recommended solution. And in the preeclampsia and eclampsia stages, these are disorders of pregnancy that are characterized by hypertension and proteinuria. So symptoms may be swelling, convulsion, nausea, as well as vomiting or headache, and even temporary loss of vision or in severe cases, coma. So adequate amount of protein, vitamins, and minerals should be provided to account for these variables and also to control for their lifestyle factors. So adequate amount of protein, vitamins, and minerals therefore should be provided. Also, constipation is a very common complication that is due to pressure of enlarged uterus and effect of placental hormone on the GIT. So increment of fluid intake and fiber in diet and regular sleeping and exercise habits can be helpful in the elimination of these problems. Also, anemia, according to the WHO, pregnant women is anemic if their hemoglobin level is 11 milligram or hematocrit percent is below 33%. So the concentration of hemoglobin in the blood is lowered due to increased plasma volume. And it may be due to iron deficiency or folate deficiency, and less often it can be due to vitamin B12 deficiency as well. So having supplement of iron and folic acid should be provided, and regular consumption of green leafy vegetables, whole cereal grains, pulses, animal meats, and liver and vitamin C rich food is to be increased in these children. Also, gestational diabetes refers to carbohydrate intolerance during pregnancy and is somewhat considered to be a common issue. So it is caused due to impaired insulin action during pregnancy, and the insulin antagonism is probably due to combined effect of placental hormone. And usually it resolves after delivery of the baby, and but requires close monitoring with the mother as well. Also, for diet, it is the main factor that influences health of the mother, and consumption of ill-balanced and inadequate diet will lead to deterioration of physical and mental strength, as well as development of anemia and general weakness in all cases. Also, socioeconomic factor can contribute, as stillbirth and neonatal death rates are generally high among pregnant women belonging to a low socioeconomic status. So, the low standard of living and living in unsanitary surroundings and poor quality diets are reasons for high stillbirth and neonatal death in these cases. Also, the mother body size can determine some of these complications. In general, tall women have babies with greater body length and weight than those born to short women. It has been found that babies born to short women are 8% lighter than those born to tall women, and babies who are born to underweight women are 8% lighter than those who are born to overweight women. And babies who are born to women who are tall and heavy are about 14% heavier than those who are born to short and light-weighted women. And for the nutritional requirement in regard to calories, there are approximately 77,000 kilocalorie energy required per pregnancy alone. This is in relation to weight gain of 12 kg. And there are more than 40,000 kilocalorie accounted for by protein and fat storage. So during the first trimester, we should add about 85 kilocalorie per day, while in the second trimester, we should add about 300 kilocalorie per day, and in the third trimester, we add about 500 kilocalorie per day. So further allowance has to be made for spontaneous decrease in physical activity, in particular occurring during the third trimester. Also, for carbohydrate, it is the main source of extra calories during pregnancy, and having a fiber-rich diet is recommended to help in preventing constipation and hemorrhoids during pregnancies. And in regard to fat, dietary fat provides a vital fuel for the mother and the development fetus. So there are a need for essential fatty acid that is slightly higher than those of non-pregnant women during pregnancy. So a very low fat diet, which provides less than 10% daily calories from fat, doesn't supply sufficient essential fatty acid or fat-soluble vitamins or even calories. Also, a diet should contain at least 30 grams of the visible fat in the usual dietary intake. And for protein, the protein intake should also be increased, as about 600 grams of protein is deposited during pregnancy in the fetus and the maternal tissue. So to fulfill this requirement, there are some recommendations to allow extra allowance of dietary protein. During the first trimester, we should add about 0.6 grams per day of protein. And in the second trimester, this increases to 8 grams per day. And in the third trimester, this increased to about 27 grams per day recommended additional intake. And for calcium, about 30 grams of calcium is deposited in the fetus during pregnancy. So the maternal reserve are in positive balance at pregnancy, and therefore absorption is not less than 40% of calcium that is available in the diet during pregnancy. So according to recommendation, adding an extra 600 milligram of calcium per day is recommended during pregnancy. Also, iron is another important mineral to include, as the fetus and the placenta contain about 230 milligram and 100 milligram of iron, respectively. So, increment of RBC mass increases about 300 milligram of iron, as well as since menstruation stop, iron losses is minimized to 230 milligram for period of pregnancy. So the addition of 860 milligram of iron is required when above factors are considered during pregnancy. So this requirement is fulfilled by providing additional 14 milligram of iron per day in the diet, and therefore it is supposed to only have 8% of iron in absorbed from the diet as well. Therefore, this should be recommended. And for vitamin A, the liver of the infant at birth contain about 5,400 microgram of retinol. So to fulfill this requirement, there are recommended additional dietary allowances that the woman should consume while pregnant, including 200 microgram as retinol and 1,600 microgram as beta carotene. Also, thiamine in small amounts are stored in the tissue of the newborn infant, and having extra caloric allowance require extra thiamine. Therefore, the ICMR has recommended an extra allowance of 0.2 milligram per day of thiamine during pregnancy to ensure sufficient intake. And for riboflavin, having small amounts are found in the tissues of the newborn infant. Therefore, extra caloric allowance require extra amount of riboflavin. By adding an additional 0.3 milligram per day of riboflavin to the pregnant women diet. Also for niacin, nicotinic acid and coenzymes containing nicotiniamide are found in the tissue of the newborn infant. So extra caloric allowance require extra niacin to be added in the diet. And to fulfill this requirement, the ICMR has recommended extra allowance of 2 milligram per day of niacin in pregnant women diet. And for folic acid, there is a rapid growth of the fetus, and the total number of RBC is also increasing. So folic acid is required for synthesis of DNAs and RNAs as well, and ICMR has recommended an extra allowance of 300 microgram of folic acid per a day. Also, vitamin B6 has a recommended additional 0.5 milligram per a day during pregnancy, as well as vitamin B12 and vitamin C, which is known as ascorbic acid. So all of these contribute to the health of the pregnant women, as well as of that of the developing fetus. So the composition of a balanced diet during pregnancy focuses on having high rich sources of carbohydrate that are also rich in B vitamins and fibers such as cereals, green leafy vegetables, and milk and milk products with fruit and vegetables. So pregnancy is a stage of rapid growth of the infant in the mother's body, and her body in itself changes physiologically to help the growth of the fetus and for preparation of lactation. Therefore, having sufficient nutrients from diet with proper health care and sanitary conditions should be maintained for safe delivery and also for better women. So, an important consideration after pregnancy is also for lactation. So, lactation is a normal physiological process in which there is production of the milk by the mammary glands of the mothers after delivery of their child. So, milk is the only source of energy and the nutrient for the newly born baby. Therefore, it promotes the optimal physiological and mental growth of the infant. So the hormonal control of lactation include, first of all, sucking by the infant, as well as the hypothalamus stimulus, and having the pituitary stimulated. That will also stimulate the prolactin produced by the anterior pituitary to stimulate milk production by alveolus, as well as oxytocin that is produced by the posterior pituitary to facilitate the uterus to return to normal size and can cause the release of milk from alveoli. So milk yield is about 500 milli in the first month, and it can reach up to 1 liter in fifth month and can decline steadily later on. So average milk production is about 650 milli, and doubling if the weight in the first 6 months indicates the infant is getting sufficient nutrient, therefore the milk production will be increased. So growth can be monitored by using a growth chart along with the age of infant and other factors such as age, health, and the nutrition for the mothers that will influence the volume of the milk that is produced. So the composition and the output of the milk are likely to be affected by the mother's diet as well as the state of her nutritional factors. So according to studies, it has shown that high-fat diet will slightly increase the fat content of the milk and its output. Also, high-protein diet will slightly increase the milk output, therefore will have better nutritional status for the baby. So for lactating women, their nutritional supplies should meet their own body needs. Also, it can provide enough nutrients in milks and can furnish the energy for mechanism of milk productions as well. And for calories, nursing mothers needs more than 1000 kilocalorie extra energy for metabolic work to produce milk, and also caloric content in the milk is partially fulfilled by having mobilization of fat stores in the body and partially by having dietary supplies. So the ICMR recommended additional intake of 600 kilocalorie of energy for the first 6 months and 500 kilocalorie of energy for the following 6 months to ensure that both the mother and the baby receive the required amount of nutrients. Also for protein, the requirement of lactating mothers is calculated on the basis of the milk output as well as the protein concentration in it. So the ICMR has recommended the following allowance of protein during the first 6 months. Additional requirement is about 23 grams of protein. Also, between 6 to 12 months of the baby period, this can be adding about 15 grams of protein as an additional source or additional intake. And for fat, the quantity of fat in the mother diet doesn't influence the fat content in the milk in itself, as the composition of milk in the fat will reflect its composition in the mother diet. So having sufficient amount of fat should be consumed in order to get sufficient unsaturated fatty acid and fat-soluble vitamins. Also, diet should contain at least 30 grams of visible fat in order to ensure for the best outcome in the baby diet. And for calcium, having breastfeeding is associated with transfer of approximately about 200 milligrams of calcium per day from the mother to the infant. So supposing that the retention of dietary calcium is about 30% in pregnancy, therefore the ICMR recommended an additional 600 milligrams of calcium per a day. And for iron, the mother milk is not a good source of iron as it contains about 0.80% milligram of iron. So the lost iron from the milk is about 0.5 milligram per day. So the losses of iron from the body is increased. To compensate for these losses, the ICMR recommended a total of 25 milligram of iron to be consumed on a daily basis as an additional source for these factors. Also for vitamin A, the quantity of retinol in the milk is about 50 microgram and a total of about 350 microgram per day. Therefore, the recommendations are to include additional sources of vitamin A, as including retinol and beta-carotene on a daily basis to the diet. So for B vitamins, the breast milk contains all types of B vitamins, and having increased energy needs also increases the need for these vitamins as well. So the content of these vitamins in milk will depend upon the content in the mother diet in itself. Therefore, this should be accounted for when we are planning their nutritional intake. Also for thiamine, about 0.2 milligram of thiamine per day is secreted via milk that is produced from the woman to her baby. So additional recommendations are to include about 0.3 milligram during the first 6 months, and this is reduced to 0.2 milligram between the ages of 6 and 12 months. And for riboflavin, about 0.3 milligram is secreted in milk per a day. Therefore, the recommendations are to include additional 0.4 during the first 6 months and 0.3 for the next 6 months. Also for niacin, nicotinic acid that is secreted in the milk per day is about 0.9 up to 1.2 milligrams. So allowance of niacin is to add additional 4 milligram during the first 6 months and additional 3 milligram for the next 6 months of the infant life. So for vitamin B6 as well, an additional 0.5 milligram of pyridoxine has been recommended to ensure that the baby has the required amount. Also, vitamin B12, adding about 0.5 microgram is recommended. And for ascorbic acid, about 3 milligram is secreted in the milk. Therefore, additional 40 milligram has been recommended with the consideration of the cooking loss. Therefore, this should be accounted when we are planning the diet as well as the cooking method. So benefits of breastfeeding for the infant include protection from infections and illnesses, including diarrhea, pneumonia, and asthma. Also, it can decrease the risk of obesity later in life, as well as reducing risk of diabetes and cardiovascular diseases, and decreasing healthcare costs in all of these conditions. While the benefits for the mothers include stimulating the uterine contractions, having convenience because there are no requirements for preparation, mixing, and heating. Therefore, this could be easier to the mother as well. Also, it is less expensive than the formula feeding, and it can reduce the risk of breast cancer, ovarian cancer, as well as osteoporosis in women who are breastfeeding. So some practices to avoid include reducing some medication intake that can be transmitted in the milk, as well as milk is exclusively the source of nutrition for and energy for the infant. Therefore, this should be accounted for. In addition, proper nutritional care is required for both the infant and the mother, and breastfeeding benefits both the mother and the infant. Therefore, it is recommended as a better solution than formula feeding. So in regard to specific carbohydrate intake, first of all, we need to understand that the word nutrition means the science that explores the need for food and the role of food in nourishing the body and fostering good health. So there are three types of nutrients. These are the macronutrients such as carbohydrate, protein, and fat. There is also the micronutrients, which are the vitamins and minerals. And there is the water, which is the vital component of most bodily functions. So this is a nutrition fact label that we should teach each woman how to read and each patient how to read in order to understand what is the content of each food that they consume. So carbohydrate is the basic fuel for the body energy and therefore constitute the majority of our daily life. So there are good sources of carbohydrate and there are others that are considered to be a less preferred choices. The good carbs include fruit and vegetables, whole grains, sugars, whole grain cereals, and nuts, therefore. While the bad carbohydrates are processed carbohydrates such as French fries, uh, cupcake, muffin, pizza, are all of which considered to be less preferable sources of carbohydrates. So there are the simple carbohydrates, which are the sugars, only providing a short burst of energy, and the body cannot use them for a long period. These include the sucrose, glucose, fructose, and lactose. And it can be associated with some risk factors, including heart disease, obesity, chronic disease, and poor dental health. So this can increases the gum disease and lactose buildup in most cases. And the second type of carbohydrate is complex carbohydrate. These are the starches that are generally more nutritious than the simple carbohydrate, and it typically contain more vitamin, minerals, and nutrients as well. Also, fiber is a group of substance with various physical properties, and it is a derivation of plant bark and not digestible by the intestinal enzyme. Therefore, it is not a nutrient and is used in conjunction with other sources of more nutrient content. Soluble fiber are mostly found in oats, beans, and prawns or sweet potatoes, for example. So soluble fiber, from the name, it means that it is absorbed in water in the digestive tract and is easily fermented by bacteria in the large intestine. And there is also the insoluble fibers. These are the more complex sources, such as those present in cereals, whole grains, and some types of fruits. So they remain unchanged during digestion and can increase bulk of stool when they are consumed. Some examples include wheat bran, whole grains bread, and cereals, and even broccoli or carrot. So we should aim to eat more fibers, including whole fresh fruits with their skins on, such as apple and potato skins, and with the edible seeds. And for water, this is an every system that needs water to function by regulating the body temperature and chemical actions, as well as disposing waste and having lubricant to joints, as well as acting as cushions for the fetus during pregnancy, transporting nutrients, and preventing bowel problems, and can help the enzymes to function properly in the body at all times to ensure better intake. We have reached the end of our nutrition related content to women health. If you have any questions, please do send them on the chat. Okay, so there are no questions. Thank you for your time. And now you will start with your next lecturer.
السلام عليكم ورحمة الله وبركاته. برحب بحضراتكم جميعا. عندنا محاضرتين إن شاء الله يكونوا خفاف عليكم، معلش احنا طولنا عليكم، وهنحاول إن احنا في المحاضرتين اللي جايين ما نطولش عليكم أكتر من اللازم. هناخد النهاردة محاضرة خفيفة عن pregnancy. معاكم دكتورة هنا صدقي. Our agenda for today is a brief introduction, a sign of pregnancy, physical change during pregnancy, assessment of antenatal visits, nutritional supplements, health education during pregnancy, managing a minor disorder of pregnancy. First of all, a brief introduction. Ideally, antenatal care begins before conception. من قبل الحمل حتى. طيب ايه هو الانتينيتال كير؟ defined as a set of intervention to modify the biomedical, behavioral and psychological والpsychosocial risk to a woman's health or pregnancy outcome through prevention and management. A history of tobacco, alcohol consumption, medical condition, medication, immunization status, risk factor for sexually transmitted disease, psychosocial concern such as depression, domestic violence, and pregnancy spacing is required. What is the goals of antenatal care? The goal of antenatal care is to reduce the maternal mortality and morbidity rates, improve the physical and mental health of women and children, prepare the woman for labor, lactation, and care of her infant, to detect early and treat properly complicated conditions that could endanger the life or impair the health of the mother or the fetus. Okay. There are presumptive, which is subjective symptom of pregnancy, and probable sign, which is objective of pregnancy. Symptom of pregnancy, subjective. These symptoms are least indicative of pregnancy. They could easily indicate or could easily indicate other condition. يعني مش 100% ممكن لو الفيميل عندها الأعراض دي تكون pregnant, such as what? Dizziness, nausea, tender breasts, mood swings, fatigue and tiredness, increased sensitivity to smell, missed period, frequent urination. الsubjective sign, they are more reliable than the presumptive symptom, but they still are not true diagnostic findings, such as Hager sign, lower softening of the lower uterine segment at 6 to 8 weeks, Goodell sign, softening of the surface uterus vagina during pregnancy at 4 to 6 weeks, ballotment, rebounding of the fetus in its surrounding amniotic fluid in response to a sudden tap on the uterus. The fetal heart tone can be detected as early 9 to 8 weeks from the last menstrual period by Doppler visualization of the fetus with fetal peak. The pregnancy test, urine versus blood. The HCG can be detected in blood as early as 7 days following conception. The HCG in urine are 1/2 or less of serum concentration. HCG can be detected in urine as early as 14 days from the date of conception. The assessment, first by history taking and clinical data gathering. Personal history, name, age, marital status, gravity or parity, if there is any history of abortion, stillbirth, preterm, a history of current pregnancy, how discovered to be pregnant, urine or blood test or pregnancy symptom, what is planned or was it planned or unplanned pregnancy, were not on contraception, used any assisted reproductive technology, when was the last menstrual period, sure or not, calculate gestational age to decide which trimester by a last menstrual period, and we add 9 months plus 7 days calculate the estimate date of delivery, and any investigation, screening, imaging, such as an ultrasound done during pregnancy. في الفيرست trimester, البريجنسي symptom, the most common nausea and vomiting, complicate up to 70% of pregnancies, where medication is deemed necessary. Antihistaminic appears to be the drug of choice. Vitamin B6 and acupressure may be effective. Ginger is good. Hyperemissive gravidarum, hospitalization for rehydration and anti-emenic therapy in case of hyperemissive gravidarum. The heartburn affect about 2/3 due to progesterone relaxes the esophagus. We manage with dietary modification. The constipation manage with dietary modification. The hemorrhoid due to increased erectile venous pressure. Like cramps and edema, بتزيد particularly at night and in later months of pregnancy. We manage it with massage, calcium and sodium chloride. Backache are common during pregnancy, managed with rest. Anemia, which can cause dizziness, palpitation, fatigue, shortness of breath. UTI manifested by dysuria, frequency, urgency. Others such as vaginal itching, fever. During the second or third trimester, fetal movement from 16 to 25 weeks. Symptom of preeclampsia may be present. Epigastric abdominal pain, lower limb edema, headache, visual issues, neurological symptom, and there is some lab investigation. Per vaginal fluid or discharge, such as blood, large gush, colored and smell. Preterm labor, which is manifested by back pain, dysuria, or contraction. When started, every how long duration and associated with pain not. Medical history, such as diabetes, history of gestational diabetes mellitus, which may be manifested by macrosomia, large baby with larger than 4 kilograms, or first degree with diabetes mellitus, hypertension, preeclampsia, obesity, PCOS, RH incompatibility, radiation exposure. What are the high-risk pregnancy? Age below 18 or more than 35, chronic disease, smoking, alcohol, illicit drug use, previous pregnancy, if there is any recurrent abortion, preterm stillbirth, birth defects, RH incompatibility, cesarean section, thromboembolism, current pregnancy, if there is multiple gestation, gestational diabetes mellitus, high blood pressure, bleeding, growth or amniotic fluid problem. Past obstetric history for each pregnancy, place of delivery, mode of delivery, gender, gestational age, date of last pregnancy, birth weight, if there is any NICU admission and why, children wellness, children with inherited disorder, any blood transfusion, breastfeeding issues, maternal complication during pregnancy, such as preeclampsia, gestational diabetes mellitus, hypertension, UTI, or after, such as postpartum, hemorrhage, hospital admission, postpartum depression and psychosis, any fever, fetal complications such as prematurity, intrauterine growth retardation, or intrauterine fetal death. A post-gynecological history, menarche, periods, we ask about irregularity, every how many days, menses for how many days, duration, amount in intermenstrual spotting, pain. A previous pap smear, a gynecological disease such as fibroid, PCOS, history of infertility, IVF, NDT, ectopic pregnancy, sexual history, pain or bleeding during sexual intercourse or SCS. Past medical and surgical history, if there is any chronic disease such as diabetes, hypertension, thyroid disorder, cardiovascular disease, renal, liver disease, seizures, hematological disorder, DVT, pulmonary embolism, or cancers, trauma or hospitalization. Past surgical history, such as a cesarean section or any abdominal or pelvic surgery. Medication and allergy, taking any current medication such as antibiotics, steroid, herbs, anticoagulant, taking any current supplement such as folic acid, iron, calcium, vitamins, use of contraception, L-type, duration, side effect, when stopped and why. Vaccination, hepatitis B, TDAP, LTB, influenza. Hepatitis B in high-risk healthcare worker with negative HBs antigen before and during pregnancy. Infant of positive HB surface antigen mother receive both HB immunoglobulin and HBV vaccine within 12 hours of birth, followed by 2 HBV vaccine injection 6 months apart. TDAP بتاخدها عند 27-36 أسبوع من الحمل. TB, all pregnant with increased risk should be screened. Didn't receive BCG, do PPD screening test. Receive BCG, blood test screening. Influenza vaccine. Social history, بنشوف الورك تايب her and her husband. Stress, consanguinity, married for how many years, any problem with husband, where she lives, family planning, number of children and timing, diet and exercise, smoking and alcohol or drug abuse, others such as travel history, pets at home, family history, if there is any multiple pregnancy, twins, chronic disease, GDM, preeclampsia, thalassemia, sickle cell anemia, inherited disease, congenital disorder, congenital anomaly, malignancy, parent alive or passed away, reason of death and age. ICE, idea of concern or expectation. What is your feeling being pregnant? Are you happy? Do you have any concerns? Do you expect us to do something for you? We should do screening for depression and anxiety. What we will do in first visit, we will take a vital sign such as blood pressure, body mass index, skin inspection, general thyroid examination, breast examination, cardiovascular system examination, respiratory system examination, lower limb examination for edema, pap smear. Second, third or fourth visit, vitals, blood pressure, BMI, abdomen, blood synthesis fundal high, زائد auscultation of fetal heart rate, position, supine, proper exposure, prom nipple line to من prom nipple line to symphysis pubis. Beginning at 28 weeks, systemic examination of the abdomen should be carried out at each prenatal visit to identify a lie. هل هي longitudinal, transverse, oblique, presentation, vertex, breach, shoulder, position, flexion, extension, or rotation of the occiput of the fetus. Leopold maneuver for fundus lateral pelvic grip. The approximate weight gain during pregnancy is 12 kilogram. 2 kilogram in the first 20 weeks, 10 kilogram in the remaining 20 weeks. Recommendation for weight gain during pregnancy are often made based on the woman's body mass index. General appearance, body build والgait, skin color, if there is any pallor, pigmentation, ascholesma, venous congestion, which is most commonly noted في leg, في vulva or rectum, edema of the extremity or face. You must look for edema, varicose vein, tenderness during examination, والmuscle wasting. Observe the mouth for the gum may be red, tender, edematous as a result of increased estrogen, dryness or cyanosis of the lips, gingivitis of the gum, caries of the teeth. Breast, assess breast size, symmetry, condition of the nipple, presence of colostrum. The size of the abdomen is expected for the height of the fundus, which determine the period of the gestation, multiple pregnancy. The shape of the abdomen is expected for the fetal lie with possession. McDonald method measure from symphysis pubis to top of fundus in centimeter. The gestation is measured plus or minus 2 weeks. At 12 weeks, the uterus fills the pelvis so that the fundus of the uterus is palpable at the symphysis pubis. At 16 weeks, the uterus is midway between the symphysis pubis and umbilicus. At 20 weeks, it reaches the umbilicus. The uterus may be higher than expected in large fetus, multiple pregnancy, polyhydramnios, mistaken date of last menstrual period. The uterus may be lower than expected in small fetus, intrauterine growth restriction, oligohydramnios, mistaken date of last menstrual period. Fetal heart sound typically audible by ultrasound or fetoscope at 8 to 14 gestation and by stethoscope after 50 weeks. Laboratory data. Blood group to determine blood type, الهيموجلوبين hematocrit to detect anemia, RPR rapid plasma regain to screen for syphilis, VDRL to screen syphilis, rubella to determine immunity, urine analysis to detect infection or renal disease, protein, glucose, ketone, hepatitis B surface antigen to detect carry status or active disease, chlamydia to detect sexual transmitted disease, with glucose to screen for gestational diabetes. At first antenatal visit, then hemoglobin will be repeated at 30 weeks of gestation. Every 4 weeks, if hemoglobin is below 9 grams per deciliter, if there is any other clinical reason, we should screen for hemoglobin test. Screening أو gestational diabetes screening usually performed at 24 to 28 weeks, but if there is any risk factor for gestational diabetes mellitus, we must start at the first visit. Two-step approach, 50-gram oral glucose challenge test, followed by 100-gram glucose tolerance test in those who screen as GCT positive, or one-step approach, 75 glucose challenge. If high risk for diabetes, previous GDM or obese, early screening may be performed. If normal, repeated screening is recommended at 24 to 28 weeks. Screening for vaginal rectal GBS colonization at 35 to 37 weeks gestation. Intravenous antibiotics should be given to all GBS carriers at the time of labor or rupture of membranes. Colonization in a previous pregnancy is not an indication for intrapartum prophylaxis in a subsequent pregnancy. Women with GBS isolated from the urine in any concentration during pregnancy or who have a previous infant with GBS infection should also receive prophylaxis. Rh negative women should be given RHD immune globulin at 28 weeks gestation and again within 72 hours of delivery if the infant has RHD positive. Rh negative women should also receive RHD immune globulin if they have any of the following: ectopic pregnancy, miscarriage or termination of pregnancy, any invasive procedures such as amniocentesis, possibility of fetal maternal hemorrhage such as in case of abdominal trauma, placental abruption. Ultrasound, one pregnant woman should do ultrasound, and why? Ultrasound is performed to estimate a gestational age, check amniotic fluid volume, check a position of the placenta, position of the baby, detect a multifetal pregnancy, any fetal anomaly. Between 11 and 13 weeks for knuckle thickness dating, between 18 to 22 weeks for morphology. A nutritional supplement, ال FDA drug risk classification كلنا عارفينها مش هطول عليكم فيها. Start before conception. أول حاجة الفوليك acid start before conception and throughout the first 12 weeks. Reduce the risk of neural tube defect in the baby. Recommendation dose is 400 micrograms per day and 5 milligrams for high-risk patients. For iron, the United States Preventive Service Task Force has found insufficient evidence to recommend for or against routine iron supplementation. The CDC recommends daily elemental iron supplement for prophylaxis or treatment of iron deficiency anemia if the HB level below 11 gram per deciliter and the HCT level below 33% in the first and third trimester, the HB level below 10.5 gram per deciliter, and the HCT level below 32% in the second trimester. Vitamin A supplementation. الزيادة في الفيتامين A supplementation might be teratogenic and should be avoided. For vitamin D, there is insufficient evidence for screening all pregnant women for vitamin D deficiency. An optimal serum level during pregnancy has not been determined. Most prenatal vitamins typically contain 400 international units of vitamin D per tablet. Data on safety of higher dose are lacking. Experts agree that supplemental vitamin D is safe in dosage up to 4,000 international units per day during pregnancy or lactation. Health education for pregnant mother. طبعا أول حاجة advise a mother for regular follow-up of antenatal visit in primary health care center. Advise the mother to follow up immediately if any danger sign appear, a red flag. Typical frequency of visit in uncomplicated pregnancy, every 4 weeks for the first 28 weeks, or every 2 to 3 weeks between 28 and 36 weeks, weekly after 36 weeks. Nulliparous with an uncomplicated pregnancy, a schedule of 10 appointments. Multiparous with an uncomplicated pregnancy, a schedule of 7 appointments. What are the red flags of pregnancy? Vaginal bleeding, persistent abdominal pain, severe persistent vomiting, sudden gush of fluid from vagina, absence of decreased fetal movement, severe headache, edema of hand, face, والlegs والfeet, dizziness, blurred vision, double vision, painful urination. Teeth and gums, the teeth should be brushed carefully in the morning and after every meal. Encourage a woman to see her dentist regularly for routine examination and cleaning. Tooth can be extracted during pregnancy. Women should avoid wearing tight clothes because they could decrease lower extremity circulation. Wearing shoes with a moderate to low heel to minimize the pelvic tilt with possible backache. Women with uncomplicated pregnancy can fly safely until 36 weeks of gestation. Pregnant women who are planning to fly should be informed about the increased risk of venous thromboembolism. Advice supported stalking, movement of lower extremity, hydration. Sexual intercourse is absolutely safe and normal unless specific problem exists, such as vaginal bleeding or ruptured membrane. Exercise should be simple. Walking is ideal, but long period of walking should be avoided. Pregnant women should avoid lifting heavy weights, avoid long period of standing, many predisposed to varicose vein. Guideline for exercise during pregnancy: maintain adequate fluid intake, warm up slowly, use stretching exercise, but avoid all overstretching to prevent injury to ligament. Exercise on regular basis, at least 3 times per week. Potential risk from contact sport, high impact sport activity with risk of abdominal trauma and SCABA. Diving should be avoided. Immunization. In brief, there are 2 vaccines that should be given to the pregnant woman, which is Tdap and influenza. Tdap from 27 weeks until 37 weeks. 4 vaccines which can be given to the pregnant woman, which are المننجوكوكال, النموكوكال, الهepatitis E والhepatitis B. 2 contraindication vaccine during pregnancy, and any live attenuated live vaccines such as the MMR and the varicella. The daily requirement in pregnancy about 2500 calories. Women should be advised to eat more vegetable, fruit, or protein, and to minimize her intake of fats. Moderate caffeine intake does not appear to have negative effect on pregnancy. However, caffeine intake should be limited to below 200 milligrams per day. البريست فيدنج كان لسه مشروح in details في المحاضرة اللي قبل كده، فمش هطول عليكم فيه. Most women with an uncomplicated pregnancy can continue working until the onset of labor. If women have medical complication or pregnancy complication, or if the occupation involves physical work, some adjustment need to be made. Common minor disorder of pregnancy such as vomiting, cause hormonal influence, progesterone hormone, relax the sphincter of the stomach and allow regurg of content into the esophagus. Emotional factor like tension, pressure of the growing uterus on the stomach. Management: eating small 6 meal, solid food tolerated better than liquid food. Carbohydrate snack at bedtime can prevent hypoglycemia, which cause nausea and vomiting. Food should not have a strong odor, should not be either very hot or very cold. Avoid lying flat, sleeping with more pillows and lying on the right side. Eat small frequent meal and avoid fried, spicy and fatty food. في meta-analysis دراسة قالت الجينجر improve nausea compared with placebo but did not significantly decrease the episode of emesis. The common dose powdered ginger from 1 to 1.5 gram orally divided over 24 hours. Ginger supplement 250 milligram capsule orally 4 times a day. Or using an acupressure point. الباك إيه اللي cause muscular fatigue and strain, increase the lordosis during pregnancy hormone soften the ligament. Management: exercise, sit with knees slightly higher than the hips, reassure that once birth has occurred, the ligament will return to their pre-pregnant strength. urinary incontinence أو السلاسل بول ممكن يحصل occur due to pressure of the growing uterus on the bladder. Management problem will resolve when the uterus rise into abdomen after the 12th week. Kegel exercise are sometimes recommended to help maintain the bladder. Constipation, intestinal motility decrease during pregnancy as a result of progesterone, iron supplementation. Management: increase amount of fruit, green vegetable which contain fiber, drinking a lot of water. Postpartum pregnancy defined as gestation that has extended to or beyond the 42 weeks. Perinatal mortality بتزيد لو بقى أكتر من 42 weeks. Introduction of labor by 41-week gestation to avoid risk of postpartum pregnancy. If pregnancy continue beyond 41 weeks, twice weekly non-stress test and amniotic fluid volume. Thank you. دي كانت أول محاضرة لنا. Any question؟ حابين تاخدوا بريك ولا نبتدي على طول المحاضرة التانية؟ نبتدي على طول. المحاضرة الجاية لذيذة جدا على فكرة، ومش هتاخد منكم وقت. يعني متهيألي نبتدي عشان بعد كده تاخدوا البريك مرة واحدة وتخلصوا، احنا قطعنا عليكم وانتوا في ويك. تمام. المحاضرة التانية هي المنتال هيلث in women. Our objective for today: a brief introduction. What is the difference between mental health and mental disorder? Common mental health disorder in women, violence and abuse among women, preventive strategies. Women health refer to. يعني إيه women health؟ The health of women which differ from that of men in many unique ways. Women health is an example of population health, where health is defined. أول ما احنا نقول صحة المرأة بيجي على طول في بالنا حكاية صحة المرأة الإنجابية، الاهتمام بالحمل، الاهتمام بالولادة، الاهتمام بالرضاعة، الاهتمام بمتابعة الحمل، البري ماريتال كونسلينج. بس ما بيجيش في دماغنا المنتال والسوشيال والبينج. Health is defined by the WHO as a state of complete physical, mental, social well-being, not only the absence of disease or infirmity. Often treated as simply زي ما قلنا reproductive health. اما نقول صحة المرأة بتيجي في دماغنا على طول reproductive health. Women and men are different not only in their obvious physical attribute but also in their psychological makeup. Women and men differ in many ways في ال way of communication، في ال deal with the relationship، في ال express their feeling و react to stress. Mental health versus mental disease. Mental health is a term used to describe either a level of cognitive or emotional well-being or an absence of mental disorder. Mental health may include an individual ability. يعني إيه الصحة النفسية؟ ability to enjoy life and procure a balance between life activity and effort to achieve a psychological resilience. Psychological resilience حاجة مهمة جدا. إزاي إن أنت أو إزاي إن أنت بعد كل تشينج، بعد كل صدمة، إزاي إن أنت بتستجمع نفسك وبتعرف تقوم على طول وبتعرف تتخطى الصدمة دي. psychological resilience ده ساينس لنفسه بيتاخد فيه ماستر ودبلومة. mental disorder or mental illness is an involuntary psychological behavioral pattern that occur in an individual and is thought to cause distress or disability that is not expected as part of normal development or culture. ده الفرق بين mental health والmental disorder. طيب المنتال ديس اوردر كان affect الومن والمان. some disorder are more common in women. في حاجات المرأة بتيجي فيها أكتر زي depression and anxiety. There are also certain type of depression that are unique of to women. احنا قلنا depression and anxiety more common in women. لا، في كمان sub type of depression unique للwoman زي إيه؟ Some women may experience symptoms of mental disorder and time of hormone change, such as prenatal depression, premenstrual dysphoric disorder, premenopause-related depression. When it comes to other mental disorders such as schizophrenia or bipolar, research had not found difference in rate than men and women في experience this illness. الsex difference lifetime prevalence rate of any kind of psychiatric disorder في المان 48%، في الومن 47%. في childhood بيبقى فيه higher prevalence of conduct disorder example aggressive and antisocial behavior في البوي أكتر من girls. During adolescence the prevalence of depression or eating disorder and engage more in suicidal ideation suicidal attempt في الجيرلز أكتر من boy. A problem with anger, engage in high risk behavior and commit suicide في البوي أكتر من الجيرل. الadolescent girl are more prone to symptoms that are directed inwardly دايما ما بتكبت انفعالها لجوه ما بتبينوش while الadolescent boys are more prone to act out دايما بيعبروا سواء بالغضب سواء بالضرب سواء بالزعيق بعكس الفيميل. The prevalence of depression and anxiety is much higher in women, while substance use disorder and antisocial behavior are higher in men. In the case of severe mental disorders such as schizophrenia or bipolar depression, there are no consistent sex difference in prevalence, but men typically have an earlier onset of schizophrenia, while women are more likely to exhibit serious form of bipolar depression. In elder age group, although the incidence rate of Alzheimer's disease is reported to be the same for women and men. الاثنين في حالات كبار السن الألزهايمر ديزيز بيتساوى الانسيدنس في الومن زي المان، بس بما ان الستات بيعيشوا اكتر فلقوا ان الانسيدنس في الومن اكتر من المان. but women longer life expectancy so الومن أكتر من men. underlying factor women life cycle a firm family system with the woman having a little say, lesser opportunity for education and employment add to plight of women. Women mental health tend to suffer as they are faced with stressor and are ill-equipped to cope. اللايف سايكل بتاعت الومن من ساعة ما بتتولد خصوصا في الدول الفقيرة أو الدول الغير متقدمة بيبقى لها ما بيبقى لهاش الأولوية في أي حاجة. لو في حد من أفراد الأسرة هيتعلم يبقى الولد مش البنت. من وهي صغيرة بيترمى عليها عاتق مسؤولية تربية أخواتها. ما بيبقاش عندها نفس حرية التعبير عن الرأي، نفس حرية المساندة. الذكر دايما بتبقى حقوقه أكتر من الأنثى. When a woman become mentally ill, services are sought infrequently and late. حتى لما بنلاحظ إن الومن ما بتجيش غير لما بتكون خلاص مش قادرة تستحمل الألم، أو لما بتبقى خلاص جت على نفسها عشان تيجي المركز الصحي. كمان إن هي بتبقى بتخاف إنها يلام إن هي عندها مشاكل نفسية، سواء كان من الزوج سواء كان المجتمع المحيط بيها. Mentally ill woman may be socially abandoned by her husband and her own family. Hence being a woman and being mentally ill is dual curses. هي عندها stress إنها woman كده لوحدها ده stress، كمان إنها تبقى mentally ill ده stress تاني. There is distress in married women أكتر من married men. The birth of child, abortion or miscarriage, economic stress, major career change are some of the stressful events in married life which are mainly gender specific. Mental disorder in women ممكن تيجي على شكل إيه؟ Persistent sadness or feeling hopelessness, misuse of alcohol and or drugs, dramatic change in eating or sleeping habits, appetite and or weight change, decrease in energy or fatigue, excessive fear or worry, hallucination, extremely high and low mood, aches, headache, digestive problem without a clear cause, irritability, social withdrawal, suicidal thoughts. ودي الwarning sign. Although the female gender is associated with favorable outcome, social consequences such as abandonment by marital families, homelessness, vulnerability to sexual abuse, and exposure to infection contribute to the difficulty or rehabilitation of women. The prevalence rate of sexual and physical abuse of women with severe mental illness are twice those observed in the general population of women. The absence of any clear policies for the welfare of severely ill women and the social stigma further compound the problem. Stigma has been reported to be more toward ill women than men, and also women caregivers become the target of stigma. Women mental health effects. Depressive disorder account for close to 41.9% of disability from neuropsychiatric disorder among women compared to 29.3% among men. Leading mental health problems of the elderly are depression, organic brain syndrome, and dementias. An estimated 80 of 50 million people affected by violent conflict, civil war, disasters, and displacement are women and children. Lifetime prevalence rate of violence against women range from 16 to 50%. At least 1 in 5 women suffers rape or attend rape in their lifetime. Mental health influences gender difference. What are common mental disorder in women? 2 times attempt suicide than men. 3 times anorexia and bulimia than men. 1 every 12 women will develop alcohol dependence during their life. 2 times as likely as men to develop depression. 2 times to suffer an anxiety disorder than men. 2 times than men to experience post-traumatic stress disorder. Depression in women are twice as likely as men. 12% women compared to 6% for men to get depression. Depression in women may be related to change in hormone level that occur throughout a woman's life. These changes are evident during puberty, pregnancy, menopause, as well as giving birth or experiencing a miscarriage. In addition, the hormone fluctuations that occur with each month's menstrual cycle probably contribute to premenstrual syndrome and premenstrual dysphoric disorder, which is a severe syndrome marked especially by depression, anxiety, and mood swings that occurs the week before menstruation and interferes with normal functioning of daily life. Anxiety and phobias. Anxiety and special phobias, although men and women are affected equally by such mental health condition as the OCD and social phobia, women are twice as likely as men to have panic disorder, generalized anxiety, and specific phobias. The factor affecting hormonal change during the menstrual cycle, genetic anxiety disorder may run in family, traumatic event, experiencing abuse, an attack, sexual assault can lead to serious health problems, including anxiety, post-traumatic stress disorder, and depression. Anxiety disorders are often treated with counseling, medicine, or combination of both. Some women also find that yoga or meditation helps with anxiety disorder. In PTSD, women are twice as likely to develop PTSD. Primary factor is experiencing or witnessing or learning about one traumatic event or a series of traumatic events. A genetic specific genotype may increase or decrease the odds of an individual developing PTSD based on a traumatic experience. Environmental. Before the traumatic event, في some environmental influence like low educational progress, poverty, childhood adversity, family history of mental illness, and more can increase an individual likelihood of developing PTSD. During and after traumatic event, elements including a severity of the experience, additional adverse life event, subsequent exposure to reminder of the event, and the lack of strong social support can add to a development of PTSD. Risk factor: being female, being younger at the time of the traumatic events, low socioeconomic status, experiencing interpersonal violence, insufficient social support, lower intelligence, lower educational level, prior mental health issues, or poor coping skills. A suicide attempt. Suicide attempt: men die from suicide at 4 times the rate that women do, but women attempt suicide 2 or 3 more often than men. Study of suicide and deliberate self-harm have been related a universally common trend of more female attempt and more male completer of suicide. المحاولات الانتحار أكثر في النساء، ولكن النجاح في الانتحار أكثر في الميل. A girl from nuclear family and women married at a very young age are at higher risk of attempt suicide and self-harm. Between الage من 18 ل 29 في ميل أكثر من ميل. As a person to failure in life difficulty and interpersonal relationship and dowry-related harassment. The causes: disturbed interrelationship followed by psychiatric disorder and physical illness, spousal violence, eating disorder. Eating disorder women account for at least 80% of all anorexia and bulimia cases and 65% of binge eating disorder cases. Most people who develop eating disorder, an estimated 90% are female, typically associated with adolescent and young women. Eating disorder also affects the middle age of or elderly women, although until fairly recently, not much was known about prevalence in their elder age group. Mental health problem during the productive phase, menstruation, pregnancy, mood and behavioral change have been observed to be associated with menstrual cycle since ancient time. Symptoms such as irritability, restlessness, anxiety, tension, migraine, sleep disturbance, sadness, dysphoria, and the lack of concentration occur more frequently during the premenstrual and menstrual phase. A premenstrual dysphoric disorder consisting of extremely distressing emotional and behavioral symptoms is closely linked to the luteal phase of menstrual cycle. And menstrual disturbance frequently occur during late pregnancy and in post. Mental disturbance frequently occur during late pregnancy and in postpartum period. Postpartum blues is the most common and least severe postpartum illness, affecting between 50 to 80% of preemie mothers, whereas postpartum depression constitutes a major depressive episode with an onset within 6 weeks postpartum in a majority of cases. Depression occurs as frequently during late pregnancy and after delivery as in developed countries, but there are cultural differences in risk factors. Risk is highest among the most socially and economically disadvantaged women. Other important risk factors include gender-based factors such as bias against female baby, role restriction regarding housework and infant care, and excessive unpaid workloads, especially in multi-generational households in which a daughter-in-law has little autonomy and gender-based violence. Mental disorder in menopause is a time of change. Menopause is a time of change for women, not only in their endocrine and reproductive system, but also their social and psychological circumstances. It has long been known that menopause is accompanied by depression and other mental disturbances. reproductive health factors, particularly gynecological complaints such as vaginal discharge and dyspareunia, are independently associated with the risk of common mental disorder. Substance use among women, although there are variations between countries' rate of substance abuse, particularly abuse of alcohol, tranquilizer, and analgesic, are increasing around the world. Women are more likely to attribute their drinking to a traumatic event or a stressor, and women who abuse alcohol or drugs are more likely to have been sexually or physically abused than other women. Significantly, more major depression and anxiety disorder are found in females with alcoholism. Thus, the profile of women with substance use problem differs from that in male abuser. However, despite increases in rates with service to assist the women are limited. The common form of violence against women include female feticide, اللي هو selective abortion based on the fetus gender or sex selection of child, domestic violence, death or harassment, mental and physical tortures with sexual traffic and public humiliation. The reproductive role of women such as their expected role of bearing children, the consequence of infertility and the failure to produce a male child have been linked to wife battering and female suicide. Consequences of gender-based violence are devastating, including lifelong emotional distress, mental health issues, including a post-traumatic stress disorder, and poor reproductive health. The common mental health problem experienced by abused women include depression, anxiety, post-traumatic stress, insomnia, alcohol use disorder, as well as range of somatic and psychological complaints. Battered women are much more likely to require psychiatric treatment and are much more likely to attempt suicide than non-battered women. Women reported high level of distress than did men and were more likely to perceive having an emotional problem than men who had a similar level of symptom. Once men recognized they had a problem, they were as likely as women to use mental health services. Men tended to use alcohol as a remedy for relief from temporary strain caused by external pressure and considered the use of psychotropic drug as indicated loss of autonomy. Women, on the other hand, used psychotropics to restore their capacity to carry out emotionally taxing labor related to their carrying work in the private sphere. Women are consistently more likely to use outpatient mental health services than are men. Men may seek care at later stage after the onset of symptoms or delay until symptoms become severe. A woman and mental health, caring for themselves. Planning for healthy pregnancy for women with pre-existing psychiatric disorder and or women who take medication for mood or anxiety problem. This includes a consultation about how to minimize the risk for psychiatric medication while trying to conceive during pregnancy and while breastfeeding, and about alternative to medication. Assessing women risk for postpartum depression or anxiety before or during pregnancy and forming a plan to reduce the risk. Assessing a woman's risk for developing depression or anxiety during perimenopause and forming a plan to reduce this risk. D. Preventive strategies. A service, a low detection and referral rate for mental disorder in primary care may affect women disproportionately more than they affect men, because women tend to present to primary health care rather than referral facility when they have a mental health problem. لما هتروح ال PHC هي رايحة عيادة طب أسرة، فاللي هيشوفها من الجيران أو من أي حد هي رايحة المركز الصحي في عيادة طب أسرة. بخلاف انها لو اتحولت للسكندري كير هي خلاص في استجمة انها رايحة لمستشفى نفسية او رايحة العيادة الخارجية للصحة النفسية. training for building health provider capacity to identify and to treat a mental disorder in primary health care services, a provision of community-based care for chronic mental disorder should be organized to ensure that facility meets the specific needs of women and men, and that the burden of caring does not fall disproportionately on women. Provide gender-specific services such as women-only day service, crisis house for women, secure service for women, education, training, and intervention targeting a social and physical environment in primary care, improving access to psychological therapies, intervention and virus level in assessment and care planning, initiative to tackle violence and abuse, develop perinatal mental health service to improve recognition of and response to the need of women and as mother and caregiver. دي resources. كده احنا خلصنا.